doves. So this gentleman is shedding light on the pros and cons of the Jamaican healthcare system versus the American healthcare system. Apart from that, he's giving a bit of heads up for Jamaican women living in Jamaica who are Jamaican citizens but who have traveled to America to give birth. He's stating that now you're being asked by immigration on your way to the States if you've ever given birth there. Ladies, look out.
States will be all too happy to tell you about the excellence and the efficiency of the healthcare services there, all while lambasting them own country. What they will not tell you is that you are going to need insurance and that every single state is run under a different governance. What they will also not tell you is that your medical bill with and without insurance is vastly different, so that your bill without insurance is $1,500, but with insurance is $3,000. The insurance covers $1,400 and you have to cover the next $1,600. What they will also not tell you is how inaccessible proper healthcare can be in the United States. If I wake up in Jamaica with a rash, I go down to my doctor, I get a little prescription, and I am well on my way. If I wake up in the United States with a rash, I have to contact my primary care physician, try to get an appointment. That is, if me even have a primary care physician. I know Jamaicans in the United States who waited months to get on the list of patients of a primary care physician. I know Jamaicans in the United States who are still waiting. So when you wake up with a rash, you are going to be going to an urgent care where you're going to be seeing a nurse practitioner and not a medical doctor. And the minute you make contact with the urgent care, they are going to tell you explicitly that if you suspect that you have an emergency, do not come here. Find yourself at the emergency room, which is a different kettle of fish altogether. Yes, they're going to roll out the red carpet. Yes, they're going to wheel you in a wheelchair and a stretcher if you want. Yes, they're going to have you check in a nice, clean room. Yes, they're going to ask you to take off your clothes and put on the back way nighty. They may even offer you something to eat or something to drink, but every single solitary thing comes at a cost. Jamaicans not tell you that. So you might be in the emergency room and you have people waiting on your hands and feet and you're saying to yourself, what manner of place is this? 2, 3, 4 doctors coming in, expressing them heartfelt sympathies and their concerns, trying to find out what is going on with you, probing, asking all the right questions, and you feel so loved, you feel so cared for, you feel so well attended to. What you don't know is that every single one of those doctors will be sending you a separate medical bill. So you check into one facility, you have a conversation with 2 or 3 doctors, especially if they are specialists. When you're done and you're gone and you're mind your own business 2, 3 weeks later, expect the bill them to start rock and come in, my friend. Jamaicans not talk about them something there. Of course, the rate of response of the emergency services can be the difference between life and death. So go ahead, call the ambulance, but understand this, it is not free. Jamaicans will go on and on telling you about the wonderful facilities where them gonna have them baby, how in they clean, and they all have place for them baby father sleep, and how them get served 3-course meals, and if they're a first time mother, how them get parental counseling. Horse dead, crow fat, and the devil knows whole. What they will not tell you is that in that process, them rack up thousands of dollars in bills with that hospital, especially if you're not living in an immigrant-friendly state like New York or Florida. Well, used to be immigrant-friendly state in the advent of the orange man. So one of the popular questions that women are asked at the embassy now when they're interviewing is, have you ever had a baby in the United States? Of course, that has implications for money where you're possibly who, as well as your residential status. And don't get me started on dental care in the United States. It's a different kettle of fish altogether.